Welcome back to the Grow Your Nutrition Business podcast. At Healthy Steps Nutrition, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach. We know that helping your clients become the best and healthiest versions of themselves isn't just about what they eat or coming to the gym a few hours a week. We, as gym owners and coaches, have to focus on a holistic approach, looking at support systems, stress management, sleep, mindset, lifestyle, and of course, exercise and nutrition. I'm your host, Nicole, registered dietitian and founder of Healthy Steps Nutrition, CrossFit HSN, and HSN Mentoring. I'm also the author of The Basics of Nutrition Coaching, CrossFit Preferred Nutrition course. In this podcast, I'm going to teach you how to make one step at a time to becoming the best nutrition coach and building an awesome habit-based coaching program. Today's podcast guest is Mike Giardina. He has been in the CrossFit space for a long time. In fact, since 2012. He's been a flow master, content supervisor. He competed in the CrossFit Games, was a head judge for the CrossFit Games. He has his level 4, as well as his master's in science and exercise psychology, as well as public health. Today, he serves as CrossFit Senior Manager for Health Education. He is one of the main points of contact for CrossFit Health. I've had the pleasure of working with him over the past few years. And today, I'm so excited that we get to talk a little bit deeper about CrossFit Health. What exactly is CrossFit Health? What do affiliate owners, what do CrossFit trainers need to know, and why should they be interested in CrossFit Health? If you're a healthcare professional, maybe you're a dietitian, occupational therapist, physical therapist, nurse, chiropractor, doctor, what can you do to get connected in CrossFit Health? There are some really cool initiatives that are coming out this year. In fact, I had the opportunity to jump in and visit one of the healthcare professional level ones over the weekend. It was so much fun to even connect with some of those healthcare professionals. So excited for us to take a little bit of a deeper dive into CrossFit Health in today's podcast. We will get to this episode with Mike right after this message. Did you know that HSN Mentoring hosts a live event every year? It's in Nashville, Tennessee. This year, we have rebranded it from the HSN Live Workshop to the Gym Accelerator Summit. Accelerate member results, member retention, your impact, and business revenue. How? Through nutrition, fitness, and accountability. This whole event is focused around one goal. Let's prioritize health inside of our gyms. Let's gain confidence with the sales process. Let's gain effectiveness in our coaching delivery and experience, and connect with other like-minded business owners who are doing similar things. People that have partnered with doctors and chiropractors and lots of different people in the healthcare space. Well, CrossFit Health is going to be there again. We're so excited for CrossFit to join us with this event. They're going to be hosting a Brews Coffee with HQ, where we're going to be talking a little bit more about how to get connected with healthcare professionals. So if you want to attend this event, we'd love to have you. This event is open for gym owners, managers, and coaches. You can also earn 14 CrossFit CEUs by attending this event. You can go to growyournutritionbusiness.com/gas, GAS, and get more details and lock in your spot. Also, you can click the link in the show notes. I hope to see you at our live event in Nashville, Tennessee, July 13th through the 15th. All right, let's get to this episode with Mike. Mike, welcome to the Grow Your Nutrition Business podcast. So excited to have you on today.
Oh, no, I'm excited. Thank you so much for having me on here. I know you've been talking about it for quite a while. So making this happen and being here to talk to you is, I don't know, it's special because we've been trying to do it for so long. So thank you. I'm glad we finally connected like this.
Yeah. Oh my gosh. It's been, I think, a year in the works now that we've been talking about CrossFit Health. I've been seeing all the movement. We've had a lot of opportunity to connect over the past year. And I'm so excited about the future of where you guys are headed with CrossFit Health. But I want us to just start with the basics here. What is CrossFit Health?
What is CrossFit Health? Well, as you know, because you've been around for a while, CrossFit Health has changed and molded over time, right? And when it first came about, Greg's focus and his focus still was on the mess, right? The ills of modern medicine and research and those kind of things. And he has the Broken Science Initiative now that he's going after. But over time, what we have done with CrossFit Health is we've taken it from exposing the mess to, okay, what can we do to help with the solution? And in a short answer to that of what CrossFit Health is it's bridging the gap between healthcare and fitness. Now, what that means to some extent is creating a network of maybe intermediaries that work as kind of gatekeepers between the patient, right? So who has been affected the most by what's going on, right? And those are the people, right? So we have the patient, and then what is the solution? Well, CrossFit, it's doing constantly varied functional movements executed at high intensity. It's our nutrition recommendations. It's our community for support and behavior change. Like, it's all of those things. So how do we get those people into the gym? Well, there are a lot of ways, but one of the ways is through CrossFit Health. And that way is using the people that are probably the most trusted people out there to these patients to speak clearly about the brand and its efficacy. And that's kind of what CrossFit Health is. So, and there's a lot of ways, right? They're speaking clearly about it. I mean, I think there's really something powerful in going to a doctor who has a CrossFit Health pin on or a t-shirt on, or, whatever it might be, is writing with a CrossFit Health pen. And that alone can break down some pretty big barriers to starting something that can be completely life-changing. And so that's our job. That's our goal. That's what we want to do.
So big picture, we have all of these CrossFit affiliates. We have all of these coaches. We want to bridge the gap between what's going on in the doctor's office, this sick care society, and help people get a fast track way to get into affiliates so that life change can happen. I think you guys are doing an amazing job bridging the gap and really bringing together the people who have the like-minded philosophy around CrossFit and the power that it can have. You talked about what Greg did at the beginning with the mess, and he hosted these DDCs, and that's where we actually got connected years and years ago.
That's right. Yeah.
And honestly, those weekends were probably some of my favorite weekends in the brand in general, like just being connected with other like-minded gym owners. I mean, Craig from Diablo, that's how I met him years ago. I was at CrossFit. I was at HQ 2 months ago and had coffee with Craig. Just the connection that we can have as affiliate owners, talking to each other, connecting with nurse practitioners, chiropractors, doctors, all of us are in this together. And when we realize this, we can all help each other, refer to each other. There's something so powerful when your doctor says, hey, go to this place. These are people that I trust. One of the best referral sources that we have at HSN HQ is a pediatrician. They don't have the time or capacity to help people change their life with nutrition. He sends all of his patients to us. It's a great referral source. He trusts us. And if gym owners got more into their communities in making these different types of partnerships with healthcare professionals, and you guys on the other side, hey, healthcare professionals, come learn a little bit more. We can work together and truly bridge this gap.
Oh yeah. I mean, there's a lot there. Absolutely. I'm going to start off by maybe letting the cat slightly out of the bag, but not completely, and saying that, yes, those DDC events were something amazing and very unique and cherished. But I'll also say that there are talks and things in the works to create similar type of events with the same intentions and outcomes. So stay tuned. I don't have all the details, But those were special, and we want to bring something like that back. I mean, the DDCs will always be the DDCs, so it won't be the DDC, but something. And then in terms of, reaching out into your communities and the healthcare professionals and clinics and offices that are within your community, solving this problem, no one specialist can solve this problem.
Right.
Right. No. So it will take a team, and it'll take a team of specialists that can work together to solve this problem. And I think, and I know affiliates and coaches fit into that team very well. And it's like you said, I mean, the affiliates can work really hard to do their part and, for a lack of a better term, infiltrate these areas. But we also have to get, these healthcare professionals and physicians educated in our network as well. So it's a bottom up and top down approach. We want to meet in the middle and just create this amazing network of affiliates and healthcare professionals with the same goal, going in the same direction. It's, I don't know how long it takes, but like it started and it's really cool. It's happening. And, I mean, I'm super excited, and there's a lot of work to be done. And yeah, I mean, it's meaningful and it's fun, and, and yeah, I'm pumped.
No, I think from an affiliate owner standpoint, this is something that you should be thinking about, because if your clients go to a doctor and that doctor is saying, oh, don't do CrossFit, you're going to get hurt, or whatever the case may be, now your client is potentially confused, right?
Mm-hmm.
Versus having a network of doctors that believes in what you're doing and is excited about what you're doing in the lives that you're transforming. And you can, hey, this person needs this help, go to this person, go to this person. And you create the network of people that are like-minded and aligned with what you're doing inside of your gym. And then you don't have conflicting views that might confuse your clients and ultimately could cost, a client in your business. So, I think it's important for gym owners to think about this, because you want to create this network in your local community and leverage and be a part and just watch what CrossFit Health is doing, because ultimately it will impact your business if you don't have like-minded healthcare professionals in a network within your community.
Absolutely. And I think there are those misconceptions still that are lingering around outside of the CrossFit community. And there are a lot of ways to, combat those misconceptions, and we're working on that. But one of the ways, which we're also doing and affiliates can do, is experience.
Yep.
Provide the experience, and that's what I think is so powerful. And there are a lot of things that are powerful about the HCP L1s and L2s, but the most powerful thing is that experience. The feeling you walk away with, the community that's developed. Yeah, I mean, I think that's the takeaway. I mean, there are some really cool takeaways that I did not expect when we did the MDL2 at the ranch back in February, I believe that was. Maybe, I think early February. But still, it's the experience.
No, I think one of the things that is so powerful about getting like-minded healthcare professionals is the network. Like, you don't know where your career will take you. And, I truly believe, coming from a dietitian that worked in the hospital, and so many healthcare professionals do work in the hospital, the system's broken. Like you can only say certain things. It was super frustrating as a dietitian. And, I would have loved to have a network of healthcare professionals that are on the other side in more of the preventative space, like, so that I could have had that network of people as I was branching out of the hospital. So, from a healthcare professional standpoint, I think an unspoken advantage of doing one of these L1s is the network of people that you are going to meet and that you'll build relationships with, and that you can stay connected with long after that weekend is over.
Totally.
I mean,
absolutely.
That was the power of the DDCs, right? Like, we came back every single quarter, and I think there's a really cool opportunity if you lean in by attending one of these and connecting with the other people that are in your group, and staying connected with all of the other people that are doing the healthcare professional level ones. It's not just for doctors anymore, any type of healthcare professional, which is really cool to create that network of people that are all really like-minded.
Absolutely. And there's continuing efforts to network post HCP L1 or L2. So some of the things that we are doing and starting this month are grand rounds, where we invite people that have gone through, professionals that have gone through the HCPL1 or HCPL2s into these grand rounds to have a specialist speak about the benefits of CrossFit in some area of their specialty. So for instance, we'll having Dr. Amy West talk about CrossFit and injuries, right? Injury rates. We'll be having people come in and talk about some research regarding CrossFit and cancer recovery. And you can just, there's so many topics to choose from. We have these specialists doing amazing things using CrossFit as part of the intervention. It can be Parkinson's, it could be chronic disease, it could be type 2 diabetes, obesity. There are so many, there's just so many, health topics to choose from that we can bring in, create some network, also some education, and so we can just kind of continue this thing going. Because one of the things that, I'm not going to say we struggled with, but one of the things that we really wanted to solve, problems we wanted to solve, is what happens post MDL1, what happens post HCPL1, right? You have these professionals out there, they're super motivated, they're engaged, they're trying to network with each other, and it's like, well, now what do we do? And we're going to start solving that problem, starting with these grand rounds, creating some events, continuing to educate even outside of the HCPL1s and HCPL2s and MDL2s.
I love that. And you guys have been doing some of the online education. You've been hosting webinars on different books with various doctors. And maybe there's a gap and people don't know if anyone can attend those. Anyone can attend those webinars, read those books, right? So it's not just for people that have done the healthcare professional level one. If you're a coach, if you're an affiliate owner, you guys picked Atomic Habits recently. Like, that's a great book for every person to listen to. Why not read the book, learn a little bit, and then join a webinar to talk with other healthcare professionals and other people in the CrossFit Health network to take a deeper dive of how you can apply that to your own coaching business and practice?
No, absolutely. I mean, that's the webinars, the book clubs, the interviews that are created. I mean, those are with the entire community in mind, right? So not just healthcare professionals, not just physicians, gym owners, coaches, CrossFit athletes, users, everybody in mind. And, it's one of the things we will continue to do is take everything we learn from healthcare professionals, whether it be through talks at events, panels at the games, webinars, interviews, the grand rounds, and make that accessible to the entire community to learn and understand. Well, what it does is it just continues, then this is a really big point for affiliates who are fighting the battle every single day. It just continues to provide some level of validation for what they're doing. And I do think that's important because, affiliates know what they're doing. They know they're doing a good job, but it is pretty awesome to see and be heard and understand, from a medical perspective, how much of an impact they have on people's lives. So that's part of it for sure.
You hosted a panel at the CrossFit Games last year, and I had the opportunity to be on it with Dr. Rodrigo, and he said something that was really profound in that interview. And I've actually quoted him a couple of times. He said, doctors are sick care professionals. The CrossFit trainers, the physical therapists, the dietitians, like, we're the healthcare professionals. We're on this side. He's such a big advocate, and he's in Brazil, right? In Brazil. Such a big advocate of everything that you guys are doing. And,
he's amazing.
I really think that there's such a huge opportunity. I mean, for gym owners that are listening to this, if you don't think your community is suffering from chronic disease, you're blind. Because if you look at the population, 60% of people have at least one chronic disease. Like, there has to be this bridge between fitness and healthcare. And you guys are trying to bridge that gap. And the more gym owners and coaches connect with other like-minded professionals and other gym owners who are doing the same thing, we don't feel like we're on an island anymore. It's tough sometimes getting up super early, all the stuff that goes into owning a gym, but there's something so powerful about the magic that's happening inside of the walls of our gyms.
Oh, without a doubt. I mean, you think about traditionally what happens when you go into a doctor's office because you're sick, especially with something that's chronic, right? I mean, acute things are a little bit different, the flu or something like that, but something that's chronic, typically the treatment makes you less sick, right? But you're like, being healthy is more than being less sick. It's more than taking a medication that takes you back to the point before you needed medication. But it wasn't the lack of medication that got you there. It was the lack of these lifestyles and behaviors that are developed within the walls of the affiliate. And of course, you can develop them in other areas, but man, there's something so powerful about what goes on inside of a community. If you look at a lot of, just like common behavior change models, you can take the really well accepted constructs from those and see how they apply to an affiliate who has good coaches, who creates, a big community and then even some smaller communities around the class, who highlights the successes of their athletes, that creates these vicarious experiences for people who are coming in and may have some type of chronic disease, maybe they're obese, whatever it might be, right? And they can look at somebody, or maybe they're just out of shape, but they can look at somebody and say, hey, that person, they're getting results and they're doing some amazing things, but they're not so far ahead of me that I can't see that they started in the same position that I did, right? And there's something really powerful about that, that takes place in the community. It takes place in the affiliate. It's a very unique experience. It's why we've been doing it. I mean, I don't know, I've been doing it since 2005. I mean, that's why people do it for so long. It's the accountability of it and stuff too.
The community piece is huge. Obviously, I think that's why every CrossFit gym owner fell in love with with being an affiliate owner, really fell in love with CrossFit and then became an affiliate owner is because of the community. But I think we can all agree, and I've seen more stuff from CrossFit HQ, and we've had many conversations. One of the things that I've talked a lot about in different conversations at past DDCs is gym owners have to be prioritizing nutrition as well. CrossFit isn't
100%.
just the fitness side. And if you're missing that piece of the puzzle, you're missing an opportunity to truly transform the lives of our clients, and accountability too, right? Like CrossFit, nutrition, and accountability is the secret sauce to helping really make a meaningful impact so that people can take control of their health, prevent and reverse chronic disease.
Absolutely. I mean, nutrition is huge. And I mean, it's along the same lines as doing effective workouts, providing effective nutrition. Like, if you want people to do it for the long term, you need to create the systems that support those behaviors. And you can get that in the affiliate. I love to use things like Verta Health as examples of this, of creating systems to support behavior change. Because if you think of something like Verta Health, who's taking people who, have type 2 diabetes and putting them on a diet that's extremely restrictive, the ketogenic diet. Could you imagine? I mean, I think we all can imagine, like, if you took somebody who had type 2 diabetes and you gave them a piece of paper and said, hey, here's the ketogenic diet, follow these instructions, and sent them home, the compliance would be very low. But when you start supporting or creating these support structures, like, well, they use technology, they use community, they use education, they use health coaches, they use physicians, they have this entire structure to help support this behavior change. And through that, they've had this massive amount of retention and compliance over long periods of time in a diet that's very restrictive. You have that in the affiliate.
In
That's what
the
the affiliate is. It's you have all of those things, community, people checking in. I mean, if it's done right, people checking in on you, you have coaches, you have the affiliate owner, you have peers, you have education, you have accountability, all of that is there.
I think
It's amazing.
the application of adding that nutrition piece is the missing link for most CrossFit affiliates that I talk to. There's something very different between what Verta Health has done, what we're doing, with the habit-based approach, one step at a time, the check-ins, keeping track of
Mm-hmm.
clients. Are they actually doing what they said they were going to do, or is there an obstacle in the way? So many gym
Mm-hmm.
owners that I talk to are just providing informal conversations. And the truth is, or giving someone a piece of paper. And the truth is, they need so much more support than that to help them see really good results. And when you structure a program in a gym, a nutrition coaching program paired with accountability, your clients see faster results, because ultimately nutrition's what, 70-80% of the
That's huge.
battle. So
Huge.
when we can do that, we're going to help our clients fast track the results. But the byproduct of nutrition and accountability is the deepened connections that you create with your clients. The in-person meetings that you don't have time to do that in a CrossFit gym setting. What you have, maybe a couple minutes between classes to say hi and check in, versus having intentional opportunities to connect with clients. When you're focusing on a holistic approach, addressing stress and sleep and support system, you can deepen that relationship, the stickiness and the magic piece of our what's happening inside of our gym so much faster, because you're creating that time and that space and having that time to check in with them. I would recommend at least weekly with clients related to nutrition. I think we're really good, and the metrics and gym softwares make it easy for gym owners to pull reports and see who's not coming into the gym, right? We see like, okay, Susie hasn't been in 7 days. I better give her a call. Like, our model as a CrossFit affiliate is people need to show up, or they're not going to continue to pay a premium for our services.
Totally.
And we're not going to help them see good results. But there's not very many gyms who have structured a way to make it easy to keep track of your clients in regards to nutrition, accountability, unless you have those systems in place. And I truly believe that, if gym owners want to do it, they should do it in-house. Don't refer out. Like, those people, you can create that meaningful impact with them when you have that program in-house, instead of referring out to another party.
No, I mean, I think that would be, yeah. I mean, if every affiliate could create those systems and provide that level of service, I do think that if you talk to affiliates, the thought is, well, a lot of times is that there isn't enough time to check in, but I do think it's because maybe it hasn't been prioritized, right? Or thought about. Checking in with an athlete on nutrition is not going to happen right before the class or after the class. You're right. You don't have a lot of time there. Like, that's a fact. But there are other ways to check in. There are other ways to create time. There are other ways to create these connections. And that's what should be, sought after. And that's what should be, prioritized in order to make these changes. Because you're right. CrossFit is concept varied function movements executed at high intensity, but CrossFit's also, you're not doing it really, and you're definitely not getting the most out of it if you're not eating well, right? And obviously we have our recommendations for eating well, eating meats, vegetables, nuts, seeds, some fruit, low starch, no sugar, then, keep an intake to levels that support exercise, not body fat. But, I've only said that a few times in my life.
That was the fastest I've ever heard it.
400 or something seminars, like you just, it's ingrained. I haven't done a seminar in, I don't even know, 2018, maybe 17, but I can just, so many of them, it's just stuck. But yeah, it's part of it. It is like, that's, if you really want to achieve the, results in optimized health and performance, it's both of those things and other things that play a role, like you had already talked about, like how do you manage your stress, how do you sleep, but the two levers you have the most control over are going to be what you're doing in the gym and what you're eating. Or how you're eating to some extent,
all of it. And
yeah,
I truly believe that we have such a powerful opportunity to impact and transform lives when we have these pieces of the puzzle in place. And you never know what you can do and the impact you can have on someone's life. We had our media team here at our gym a couple weeks ago capturing some stories, and one of our members told us his story of why he joined the gym. He said he drove by, and we have a sign that says we cure diabetes outside. He said he drove by that
I
sign
saw
for
that.
6
I love it.
years. 6 years he drove by that sign. And he said finally the reason why he ended up stopping one day is he went to a theme park and wasn't able to like click the
Yeah.
thing. And I've heard a similar story from another person about the seatbelt in the airplane, but he's like, that was the point where I was like, okay, I'm done with the lifestyle that I have and I need something completely different. And he signed up, did nutrition, fitness, and accountability. But the coolest part of the story that he started talking about now that he's been doing it for a while, he's been almost a member for a year now. He's lost a ton of weight because he's had that accountability, because he prioritized his nutrition. But the really cool part was he's like, I struggled with depression. I was on antidepressants. I was seeing a mental health therapist every single week. He's like, I was scared to walk in a room with people. He goes, all of those things are now not an issue like I had before. And it really came down to him being consistent, getting involved in our community, being consistent in the gym, having that coach keep him accountable with nutrition, really starting to see the results to gain confidence, and then realize like, holy cow, my mental health is so much better. He's like, I don't need to take the antidepressants because my antidepressant is coming to the gym 6 days a week. Like that, I feel so much better. And while I'm not saying, get off your medications, I'm saying there's a huge opportunity to like take control of your own health by focusing on the factors that we can control. And he was just a really great example. I was excited to capture that story because I know that so many people are struggling with mental health and chronic disease. And, instead of just falling into this rabbit hole of, okay, I'm going to go to the doctor, I'm going to take more medications, and I'm just going to wait till I have to reach the next stage of this disease and then get on another medication, which is the healthcare system,
That is the healthcare system.
When I was working at the hospital, it was a revolving door of, we never really taught people how to manage their diabetes. Like there just wasn't time and what we were allowed to say versus let's just start off eating more whole foods. Like start out, eat meats and vegetables, nuts and seeds, some fruit, little starch. I say minimal added sugar, but instead of no, I want to be too aggressive.
Well, and then that's the, that's always the thing. It's like no sugar, but in real, like, realistically, there's minimal amounts, right? Like, yes, you should avoid it as much as possible. You should avoid processed foods as much as possible. And that's really the idea here, for obvious reasons, right? Like, one of the biggest reasons is, well, it's really hard to control eating when you're eating processed foods.
Yeah.
It's extremely easy to overeat. But does that mean that, is it really that for the rest of your life, it's no sugar or no processed foods? No. Right. But it's minimal. It's like I don't want to put a percentage on it because I think that percentage is going to change for everybody. But, maybe it's 80-20, maybe it's 85-15, maybe it's 90-10, maybe it's something like that. But the vast majority of what you eat, whole food sources, that's hard to argue. It just really is.
It's amazing what happens when clients start connecting the dots between how they feel, how they sleep, how they recover, how they feel during workouts. Like when you start connecting all the dots, because most people don't connect what they eat with how they feel and how they sleep. And once they do, it's not, oh, I have to eat this way. It's, I want to eat this way because I want to feel my best. When people start connecting those dots, it goes from, okay, this conscious decision of I'm doing this to this unconscious decision where I have this lifestyle that I can maintain forever. I was reading a book last week, and one of there was a study that came out of Duke, and they were talking about 40% of the actions we take are unconscious decisions. And I would venture to say that most people's 40% are not healthy behaviors.
No. Yeah. I mean, that's absolutely.
And so it's like this unconscious, like unhealthy routine that we've gotten ourselves in.
That's why it's so hard to change your habits, because you don't even think about them half the time. They're like just like built into what you do. You don't even realize that it's a bad habit. So when you're talking about, exposing a bad habit and changing it. Like that's a tough thing to do because it's on autopilot, you know?
Right. And I think that's where there's something magical that can happen inside of an affiliate, because you can help clients realize, let's just take one step at a time. Let's stay consistent with this one thing. Let's make that automatic and then work on that next thing, instead of changing 1 million things at a time, people feeling overwhelmed and then going right back to the old habits that they have, which is what happens most of the time, which is why people fail with making long-term change, because they tried too much. Amazon has ruined us, thinking that we, can change all of the things and get instant results. And in reality, if we actually slowed down our progress and our process, we would see much more lasting results. And from an affiliate owner and a coach standpoint, it's keeping our clients accountable to one thing at a time. Hey,
Oh
this
yeah.
week we're just focusing on this one thing. And from a big picture affiliate standpoint, when you walk into your gym, like, is it obvious that you prioritize health? You mentioned something earlier. Are we highlighting the clients that are doing awesome? Are we talking about those successes that are happening? If you're not, you're missing an opportunity for other people to realize that you can there's something way bigger than the WOD that's happening right here. Like, there's something way bigger to impact your life so that you can ultimately fulfill your mission in life when you are prioritizing your health, wellness through nutrition, fitness, and, in my opinion, accountability.
Yeah, I mean, everything you just said, ties directly to improving somebody's self-efficacy, right? And it's not even like when you talk about highlighting somebody's success. I mean, yeah, obviously that makes them feel good and improves their own belief in themselves as well, and their ability to accomplish a task. But it's really about the person who's looking at that, right? That's the big change. That's the person that you look at that and you say, well, okay, well, maybe I can do that. And that's a boost in your self-efficacy, your ability, your belief in your ability to do something, right? And I think that's huge. And I think that goes the same way with, like, well, don't give them too much too quickly to change, because that's a recipe for disaster. I mean, there are some people that are ready to do that, but most aren't, and start a little small and create these small victories and celebrate these small victories, because that's another step to improving one's belief to do these things, right? Like, oh, I can do it. Like, this is small, but I can do it. And now I've got some momentum going. I think I can do the next step, and it compounds. And that's why I think when it comes to nutrition, where people miss the boat is they focus solely on education, and education is just part of the battle. Like, you can educate somebody all they want, that doesn't mean they're going to actually do it. Like you have to put in the processes to create the right habits, right? It's the difference between setting a goal and setting the process to achieve that goal. Like, you have to set the processes, and you actually have to focus on each process and not just the end goal. Like, it's about that process, then the next one, then the next one, then the next one. And that's what gets you to the goal. And I think that tends to be the missing part of, improving nutrition within the affiliate. Not everybody. I mean, people do it really well, but I think that's where we need to focus, outside of just educating our members.
Couldn't agree more. If you make it easy so that people can walk away knowing exactly what they need to do to be successful, every single step they need to take, there's no guesswork. I mean, people are overcommitted, they've overscheduled themselves. And if you make it harder and more steps that they have to think about, then they're not going to do it. They're not going to stay consistent versus, hey, this week we're focusing on a balanced breakfast. What does that mean? When are you going to shop? What is the breakfast going to look like? When are you going to make it? Are you going to bring it to work? Are you going to eat it at home? Like, literally lay out every single step for them so they know. And then all you have to do at that point is just keep them accountable. Did you have a balanced breakfast? Did you do what you said you were going to do? And
Yep.
I think that's a piece that a lot of coaches miss, because if we're not checking back in, did you do what you said you were going to do? And they don't, then your program didn't work, when in reality, they just didn't do the work. But would they have done the work if we had stepped in a little bit earlier to keep them accountable to what they committed to? Probably.
Yeah, probably. And then, the more you do that, the more success you have, the more people you have in your gym that are eating the right things, talking about the results they're getting, it becomes the normal behavior. It becomes the
Yes.
normative behavior within the community that this person
Yes.
has inserted themselves in. And as humans, like that's what we want to become. When we're in a group of people and there are normal behaviors in that group, we change to be more like the group. So like, but that's the job of the affiliate owner and the coach, right? Like you need to establish those normal behaviors. You need to get enough people doing them so that now that's the overwhelming behavior within your community. And then when people come in, it's just another step to make it easier. I mean, it's never going to be super easy for people to change, but man, that helps.
For sure. I love it. Mike, you actually spoke at the live workshop last year. Someone from CrossFit Health, maybe it's going to be you, maybe it's not going to be you. But you guys are going to come again and talk about bridging the gap between fitness and healthcare. We have the affiliate team coming. We talked about doing brews coffee with HQ one morning, which I think will be really fun for awesome. CrossFit affiliate owners, just to connect with you guys and be in the loop of what's going on and just understand how we can all work together to achieve the ultimate mission of, changing as many lives as possible. Right.
Yeah, no. And thank you for having us. And it's super important because we've spent the last year like really focusing on just a barrage of content, right? Content. Every rest day, we've put it all out to put CrossFit Health back on there, on the map, get our healthcare professionals, our physicians fired up again and excited. And now it's things like this where we can start making these connections with affiliate owners, with coaches, as well as our healthcare professionals. That's where the real difference comes. So we've kind of set the groundwork, and it's events like this where we get to now make that connection. So thank you.
I love it. And then can people expect you guys to be at the games again? Are you going to you hosted a lot of different panel discussions that were really great. You had all different types of experts coming on. Can people expect, if they're going to the games, to see you guys in CrossFit Health there as well?
Yeah, we're going to be there. We will have panels again.
Awesome.
We're working to have, a more present booth to where we can now have these conversations with whoever, whether it be healthcare professionals that want to talk, affiliate owners that want to learn more, coaches, athletes, doesn't matter, whoever it might be. So we'll have that. And we're looking to do something special for affiliate owners in the affiliate lounge. So stay tuned for something there.
Cool.
So no, we're excited. Yeah, we'll be at the games and can't wait to see everybody there.
Awesome. How can people stay in touch with you guys? Obviously, if you're coming to our live event, the GAS event in Nashville, Tennessee, July 13th to the 15th, CrossFit will be there, CrossFit Games. But for the people that are looking to stay connected with you guys online, the CrossFit Health social media, Instagram channel, is that the best way to stay connected?
Instagram, CrossFit /health. You're going to get all the information there, ways to contact us. If you're a physician or healthcare professional, you can get on our list. You can join. One of the best ways is to, we have a healthcare professional group on Facebook, as well as a physician group and MD group on Facebook, where we talk a lot about what we're doing, where we're going. There's a lot of discussion on what they're doing, a lot of networking there. I think if you don't have it yet, the HCPL ones and HCPL twos, because that's how you get into the network, and get into the grand rounds and have opportunities to come to other events that, are similar to like DDCs and that kind of stuff. But it all starts with, Instagram and our CrossFit Health webpage for sure.
Awesome. If you're an affiliate owner and you have healthcare professionals in your gym, just mention it to them. There's no pressure, but mention that. I think it would be a really great opportunity for healthcare professionals to, again, get their level 1 so that they can connect with other like-minded healthcare professionals and just grow this ecosystem so that we have people that we can refer to that can refer to us and ultimately make a greater impact overall as a brand for CrossFit and then in our local community.
Absolutely. And we're also always looking for amazing stories. And I know they're out there. I mean, we've seen them all the time. So whether you are a CrossFitter that has overcome something amazing using CrossFit and with a coach or a healthcare professional, or you're a healthcare professional doing something very unique within the CrossFit community, we love to hear about it. So please share it with us.
Awesome. Mike, thank you so much for all that you do. Thanks for coming on the podcast
and
chatting with us. And I hope that we get to see you in Nashville, but either
I
way, we'll
know.
see you at the games.
Absolutely. Thank you so much. This has been so awesome. It's been great. Thank you.
CrossFit Health is doing some incredible things to bridge the gap between what's happening inside of our affiliates and in healthcare. There's such a huge opportunity for doctors, physical therapists, CrossFit trainers, dietitians to all work together. Ultimately, we've all dedicated our lives to helping people get healthy, to transform lives. We can make such a greater impact doing this together. As I mentioned in the opening, I did have the opportunity to go connect with some of these healthcare professionals at the Healthcare Professional Level 1 in Miami last weekend. It was so fun to just watch this group interact with each other. And I had an opportunity to talk to one nurse practitioner. She said, we don't have the time to help all of our patients with the lifestyle changes they need. I need to refer to a dietitian. I want to refer to someone. So we ended up connecting information, but ultimately those conversations happen when you connect with other like-minded individuals. Doctors know they don't have time to do everything that they need, everything that their patients need to make the lifestyle changes. They don't have the opportunities to provide them the accountability and support. That's where we come in. As gym owners, as CrossFit trainers, as dietitians, as nutrition coaches, we can work together to bridge this gap together and ultimately make such a greater impact. Well, one of the things that you can do is connect with CrossFit Health and stay tuned to what they are doing. I know live events is something that they're excited about, and we are hosting a live event in Nashville, Tennessee. It's called the Gym Accelerator Summit. The goal of this event is to bring gym owners, coaches, and managers together who are all prioritizing health inside of their gyms so that we can gain confidence, gain clarity, and provide an exceptional experience to ultimately fast track clients' results. Because I can say with 100% conviction, when we combine an effective habit-based nutrition coaching program with fitness, with CrossFit, with personal training, with group fitness class, and accountability, our clients see such better results. Why not work with other people so that we can make a greater impact in the community? Well, one of the things that we're going to be doing at the Gym Accelerator Summit is, of course, talking and role-playing different conversations. And one of those conversations is going to be around partnerships with healthcare. We're going to be taking a deeper dive into this in one of our brews with HQ. It's going to be on Saturday morning, July 15th. So make sure that you lock in your spot today. I promise you will walk away with actionable steps so that you can make health, wellness a bigger priority in your business. So ultimately you can transform more lives. Hope you enjoyed this podcast episode. Don't forget to subscribe, leave us a review, and we'll see you back here next week.